medyo mainit pa din yung mga tanong for Dr. Guinto. So there's how to prevent pre-eclampsia or eclampsia.
Before pregnancy, so if you have a patient who consults preconception, okay, and that patient has a chronic disease such as an SLE, or chronic hypertension, or a kidney disease. So that patient, the disease has to be controlled prior to pregnancy to decrease the complications related to those diseases, especially the development of hypertension itself.
How to avoid it in the future.
Aim for a healthy lifestyle, exercise, have enough sleep, decrease the stress, eat nutritious food, no smoking, okay, no alcohol. So those are things that would improve your life, your body, as well as aiming for a normal BMI. So those are things that would decrease the risk of preeclampsia. But in most cases, actually, you cannot do anything to prevent preeclampsia pre-delivery. So there's no scientific studies that would that shows improvement in terms of preventing preeclampsia, preconception, especially when you are genetically predisposed to it, meaning you have a sister or a mother who had preeclampsia also. During pregnancy, in the first trimester, it's part already of good prenatal care to screen a patient for the risk of developing preeclampsia. Screening is done at 11 to 13 weeks and 6 days. So there are different ways of screening. In low resource settings, you can just do maternal risk screening, look at the history and the physical examination. But in better resource settings, like in some of our institutions here in Metro Manila, you can also do biochemical tests, including and also Doppler ultrasound to screen these patients. And once you see that the patient is high risk for developing preeclampsia, then we give the only treatment for now that is scientifically proven to decrease the risk of preeclampsia is low dose aspirin. And then it has to be given before the 16th week age of gestation. We stop it once the patient develops preeclampsia or when the patient reaches 36 weeks. In addition, okay, preeclampsia is also increased in patients who have low calcium diet. So you have to have good calcium amount in your diet, or you can take extra calcium supplements during pregnancy to decrease your risk of developing preeclampsia. So calcium supplement, high dose calcium supplement will prevent preeclampsia in those patients who have low calcium in their diet. But for those who have normal calcium, this will not prevent it. But aspirin, low dose aspirin will, if you are high risk. And then to prevent, because if you have hypertension now, you are at risk also of developing hypertension in your next pregnancies. So to decrease the risk, the same as preconception, the ones that I said earlier, in addition, you are recommended to exhaust efforts to remove all the weight gain that you had during the pregnancy, during the next 1 year postpartum. So this will decrease your chance of cardiovascular problems, not only preeclampsia, but other cardiovascular problems later in life. So you have 1 year to lose all that pregnancy weight.
moves in real time. So should our healthcare technology. With information needed, decisions to make, and experience to share, every second counts. Live integrated tele-ultrasound enables real-time communication, remote collaboration, confidence, knowledge, and learning. The first ever integrated tele-ultrasound collaborative platform. Philips Lumify. Integrated tele-ultrasound powered by React's collaborative platform. Innovation and you. Philips.
There's still a lot of questions coming in from our very for Dr. Hermar. If you experience vaginal delivery and notice massive hemorrhage from the vagina, and it will take time to go to the hospital. So is there any way to control the bleeding while going or transferring to the hospital? Mm-hmm.
Okay, so first, as I said, you have to determine the cause. So check the uterine tone because it's the most common cause. So after delivery and she's bleeding, check if the uterus is well contracted. And the first thing that you should do is to massage the uterus so that the uterus will contract. So somebody mentioned here, is it okay to put cold compress? It can help, but not alone. So it can help, but make sure you massage the uterus. It's the one that's more important. And then if you have dapat kahit home deliveries, you have oxytocin because you can give that IM. But if not, kung wala talaga, uterine massage, and then keep your fist inside the uterus as much as possible. If you can do that, parang tamponad na rin siya, and you're massaging the uterus on the way from the home delivery up to the hospital. That would help. No, another thing is if you can check if there are lacerations, then and you can sana naman you can repair, but if you can't repair at home or hindi siya midwife delivery, no, I'm assuming this is, let's say, delivered at home biglaan, but you can also put like gauze packs, kung walang gauze packs, any cloth that you can use to tamponade or pads that you can use to tamponade the area because of, let's say, may genital lacerations, because next to atony would be trauma. Diba? So you should have time to get to the hospital. Another thing is you can also in that setting, I can only think of, let's say, the bleeding is such that syempre you can't transfuse yet. You can replace kahit oral fluids muna para lang to get the going. But syempre yun na nga, call for help and go to the nearest hospital. But you can do uterine massage and tamponade muna until you get to the hospital.
For Dr. Guinto, regarding the gap between giving hydralazine and magnesium sulfate.
Maybe they're thinking of nifedipine because
Yes.
there are concerns before with increasing the effect of magnesium sulfate when you give nifedipine in addition to magsulfate. But evidence has shown that this is not so. So hydralazine can be given with magnesium sulfate. In fact, we give it all of the time. And nifedipine can also be given with magnesium sulfate.
So thank you again, Dr. Guinto and Hermar.
Thank you very much also.
Yes.